Now we're going to demonstrate the syringe method. First, I'm going to sanitize my hands, of course. Put on my fluid impermeable laboratory coat and a non-sterile gloves, as so. And I will be verifying the patient's identity by two identifiers, which is their first and last name and date of birth. And we can also use a picture identification as well. I will assist the patient in a sitting position with the arm well supported and straight, slightly downward. As you know, that I've assembled my equipment and my supplies. Usually we choose the syringe bearer based on the amount of blood that is required for this particular test that's been ordered by the provider. Now, I will apply the tourniquet onto the patient's arm, as so, 3 or 4 inches from the elbow, not too tight. And what I'm going to do is locate the vein. I'm going to ask the patient if they can ball their fist. Thank you. Oh, that's a good one right there. Okay, I look like I located the vein. I'm going to remove the tourniquet from the, we can't leave it on no more than 60 seconds. Okay, what we're going to do now is apply alcohol wipes from the center onto the outer area in a circular motion. While the arm is drying, we'll be assembling our syringe and the needle. And make sure that the package has not expired, otherwise it's not sterilized. Here we go. We're going to assemble it as so, turning it as again. Turn it tightly so make sure there is no air leakage. There we go. Now what we're going to do is apply the tourniquet back on the patient's arm, as so. Again, 3-4 inches from the elbow, not too tightly. And I already marked what the vein I've selected. And then I'm going to ask the patient to ball their fist as I begin to insert the needle, insert the syringe. Okay, now we'll remove the the sheet from the needle, as so. And I'll use my dominant hand, and with the bevel up, I will use my non-dominant hand, press the skin out, insert gradually, keep it steady, go. Now I have enough blood, so let's do about 3 milliliters. I will pull the plunge back slowly, because we don't. And also don't forget to go up and down with the syringe, it's been in the package so long so it can loosen up. So I'll go slowly as it feels. I'm almost there. Keep it steady. There we go. There we go. Try not to move. I will use the gauge to move the needle. Don't apply pressure on yet. Out swiftly. Use the safety guard of the needle. I will apply a Band-Aid. Apply pressure. As so. There we go. Okay. And remember, I have released the tourniquet from the arm before I remove the needle. Now that the patient's been taken care of, now that the blood is in the syringe, we need to transfer into the tube. How are we going to do that? This is how we're going to do this. We're going to remove the needle, as so, from that. Place it in the biohazard container. We're going to place this tube, twist it on, as so. There we go. And we're going to apply one of the tubes here. And we're going to hold it there in a vertical area and let this vacuum do its trick, do its job. Now it has filled up. Again, we shake it. Place the entire thing in the biohazard container. We're going to place our specimen in the biohazard bag for transport. Now what we want to do is not forget, let's continue to inspect the puncture site. Make sure there is no bleeding or hematoma. Looks great. So we're going to apply that again. We're going to remove everything that's contaminated by blood, including, while we're doing that, we did that. Then we're going to sanitize our area. This, like I said, dispose any blood contaminated material. And we're going to also remove my gloves and hang up my coat if it's not soiled. We already sanitized the area, sanitized my hands, and we have now completed the process. Now we're going to record the procedure in the patient's record log that completes the process.